Welcome and thank you for joining us. As a reminder, we have you muted for our initial briefing. Once the briefing is finished, you can use the Zoom application to either raise your hand for a question or you can type your question in the chat. If you've called in via phone only, you can use *9 to raise your hand. In addition, please make sure to identify yourself by your full name and the organization or media outlet you are from prior to asking your questions. With that, I'll turn it over to County Manager Mike Callagy.
Hi everyone, how you doing on this beautiful Monday, April 27th briefing? Let me just start with the stats. We've got 1,080 now tested positive in the county of San Mateo, with 41 confirmed dead. That's holding from last week. And in regard to our shelter, this is the big news really, is later this week, the 7 Bay Area health officers will issue a statement. As it went out today, I'll just read the parts that are pertinent. Later this week, the public health officials of the counties of Alameda, Contra Costa, Marin, San Francisco, San Mateo, and Santa Clara, as well as the city of Berkeley, will issue revised shelter-in-place orders that largely keep the current restrictions in place and extend them through May. The order will include limited easing of specific restrictions for a small number of low-risk activities. Some of the justifications, those hospitalizations have leveled, but more work is needed to really safely reopen our communities. Prematurely lifting restrictions could easily lead to a large surge in cases. The health officers will also release a set of broad indicators that will be used to track progress and preparedness in response to COVID-19 in alignment with the framework being used by the state of California. Future easing of the restrictions requires that each jurisdiction and various sectors continue to rapidly build critical infrastructure and systems to respond to the control of the spread of the coronavirus infections and ensure that healthcare systems ability to meet that. And we're in good shape right now. As you can see from some of the information we put out, our ICU beds are doing really well with 68% availability, 92% ventilators, and 95% surge beds with 74 patients that have the coronavirus right now. I don't think it's shocking. I think that we said all along that things would open up incrementally, and I think that that's where the health officers are right now. We'll have to wait and see what those specifics are in regard to the limited easing that they talk about. I can tell you that, and I have told you, I think in the past, that we have been planning a strategic reopening of the parks. That reopening will take place next Monday, a week from today. And it will be a phased strategic approach. It will not be business as normal. When we went into shelter in place, we saw a surge in the parks, even though people were supposed to stay distant and maintain that social distancing. We saw a surge in the numbers of parks like we have never seen in the past. So we have now been able to work through a process where we believe that we can reopen the parks, and not all of them right away, but reopen some parks in a strategic way that will maintain social distancing, that will be responsible, and try to keep people healthy while enjoying the outdoors. Again, this will be phased. If we open some of them and people adhere to the precautions that we put in place, we will then take a look at phase 2 and open more. And every phase has more openings. To the extent that we get to a certain phase and we see a resurgence of this, we'll be able to pull back a phase or 2 without maybe closing them. So again, we understand and encourage people to recreate during this time of stress and uncertainty. And we will have specific, I'll make the specifics available later on in the week, and we'll start promoting those, but they'll include one-way trails and monitoring by rangers and signage. And again, not all parks will be open, but we'll be doing this in phases as more information becomes available and as we learn more about the direction of this disease in particular. So along with that, a homeless shelter update. We have 33 clients who are sheltered at the Bayfront Station homeless shelter that we've created now. So we've got, they're utilizing 27 beds. And the county's specialized hotel program in collaboration with our shelter provides over 80 vulnerable homeless clients are now in hotels. So we've got the capacity, again, we're looking for the most vulnerable of those in the community who are homeless to take up these beds. And we've got 80 now in, and we've got room for more. So we've got another 23 on the request list today. We'll be looking at, and 13 of them are high risk. So we're working through that process of trying to get as many sheltered as possible. You know, in the way of new information, I think that's the highlighted information that we have to date. And I'll answer some of these questions as the best I can that have come in before we went live here. Submitted media questions. Number one, are the low testing numbers at the event center because of low interest, too high criteria, or not enough test kits? I think it's really a combination of all three things. I think that the high standards, you have to have 2 symptoms before you get tested, is prohibiting some people from getting tested. I think that you know, it's not the most comfortable situation to be tested either. But I think those who need the test absolutely should get the test. And it's a function of not opening it up to random testing because of the supply kits, the unavailability of supply kits right now. That will get better over time. In the next week or two, we've heard the governor's office talk about ramping up. We have requested through the governor's office 2 more test sites in this county, one in the north and one in the south. And we'll see, you know, about the availability of those coming to San Mateo County. In the meantime, we do have the ability at the event center to do massive testing there. You know, probably in the area of 1,000 a day if we have the test kits, and if we loosen the criteria, bring it down to 1 symptom or no symptoms. We have that in place right now for first responders, for those in the health field, and we hope to do it for more essential services workers and then the general public as soon as those kits are available. Question number 2, Dr. Morrow has talked about getting tracing data to match up with a state data program as a key step. Has there been any progress in it? So the county health is currently working on ways to increase the number of contact tracers training the county staff. I mean, we're going to need, and I've mentioned this before, a small army to do this. And we're in the process of putting that army together, training them, and having them ready. That is one of the 3 legs necessary for that stool we keep talking about in order to reopen. So contact tracing, PPE, and certainly the testing. So we've talked about 2 of those. Let me just say the PPE side of things, you know, we have had several orders out there only to be canceled or delayed, and that remains the same. We're supposed to have an order in today that has now been delayed till May 5th. So these are things that we're constantly trying to overcome. We had another order that was supposed to come in. When it got here, it was sold to someone else, presumably for a higher price. So these are the things that that we struggle with, as do many, with the shortage of PPEs. Also, public health has invested in 2 software platforms aimed at carrying out the case contact investigation work. And this is very important. The electronic case management platform, REDCap, enables efficient distribution of workload and allows for documentation of the case, contact investigations, as well as data analysis. So there's many fronts to this. There's not only the physical upfront people that need to do the contact, there's the data side behind it and the technology behind it that we'll be utilizing. We'll also implement a texting contact software which enables efficient outreach without having to rely on missed phone contact attempts. And we're working to learn from other jurisdictions what has worked and certainly not recreate the wheel. So we do have IEM looking at this from around the world also, and looking what's going on there. We also had IEM on the call today, talking about the difficulty of reopening, the resurgence of cases in Korea after they opened, and in Japan after they've opened. This is not something that we want to engage in, obviously. This is what we're trying to avoid, in making sure that we have everything in place necessary for when that time comes that we do open, that we are prepared, and we are responding responsibly. So with that, let's see if there's any other questions.
No raised hands and no chat questions. I guess we'll give a moment. One raised hand. There we go. Henrietta J. Burrows.
Yes, thank you so much. I have several questions. One, you mentioned, excuse me, the possibility of low-level businesses being allowed to open. Do you have any idea which would be considered the low-level businesses?
I think that they're still considering that the health officers are working together. I don't think they have finalized that. So I'm going to wait till Wednesday and let them reveal what businesses they're talking about. I think that's still some work needs to be done around that right now.
Okay. You've talked about the housing of the homeless. How many first responders are being housed in the county, and are there any figures yet on how much the county is paying?
Well, in general,
responders who would be living out of the area.
Yeah, I don't think that, Peter, correct me if I'm wrong, I'm not sure if we have any right now, other than some of the medical staff that we brought in to really handle the situation at our step-down hotel. We're certainly housing them, but that's part of their contract I think they take care of the housing in their contract. But as far as first responders in county, Peter, are you aware of any?
So we have employees that live outside of county that, because of the activation, they live here in this county at a hotel, so they don't have to go back and forth every night. So we have that.
Can we get that number, how
Sure.
many, and maybe the cost associated with that? That would be great. And then, Henry, we've also asked for, FEMA for reimbursement of these costs. We were one of the first in line, and we're going through that process right now. We do believe that, we will get eventually, on at least on this first round, 75% of that money back through FEMA. At least that's our hope.
Okay, thank you. If no one else has a question, and I can wait to see if anyone else has a question, I have another one.
Oh, go ahead.
It seems kind of outrageous that the county would order PPE and have it on its way and have it confiscated. So is this PPE that's already been paid for, and is there anything the county can do in terms of protesting?
Well, I mean, it's like we've mentioned before, it's a wild, wild west out there, and it's a buyer's market or seller's market. I'm sorry, as numerous buyers are trying to buy this all at once, and it's difficult. It's just there's promises made and promises broken, and those are the type of things that are difficult. But this has happened from day one, where we've ordered things and then, POs would be canceled halfway through or later on. And it's just one of those things that everyone's experienced. I mean, the state can't even get it. I mean, the federal government, the military can't even get PPEs. It's just unbelievable. And we're doing, I think that everyone's been pretty creative in making their own masks, and there's lots of folks out there volunteering and making masks for folks like the homeless, and certainly some of these here, we've received through the benevolence of a lot of great groups. So it's just the name of the game right now. When there's not enough, it's a supply and demand issue, and we are in demand and there's short supply.
The county hasn't lost any money, though, in the process, has it? No,
good question. No, typically we're not going to pay for it till it arrives, and usually it's on a 30-day PO after it arrives, so that the payment plan. Though we've vetted through many unscrupulous, fraudulent buyers who offer it and want the money up front and those type of things. And that's that is the first sign to us that it's a fraudulent deal, and we haven't, you know, we certainly would not engage in anything like that.
Thank you.
Okay, we have a couple chat questions. First one from Austin Walsh. There's a limited easing of specific restrictions for a small number of lower risk activities being evaluated by health officers. What types of activities would be considered lower risk?
I think that's a question that remains to be seen, really. And that's something that we're just gonna have to wait for the health officers to come out with on Wednesday. We are, you know, that's still trying to be worked through as to what they entail. I think that, you know, certainly by Wednesday we'll see the complete order, I hope, and all those questions will be answered at that time.
Okay. Next question from Emily Miebach. Stanford Healthcare is cutting salaries and workers' hours. Is County Health looking at making similar cuts?
You know, we're not at that stage yet. You know, and I hope that we don't get to that stage. Obviously, it's a little bit easier to do in private for-profit organizations than in a county where there's collective bargaining agreements in place. We have, the board here has been very prudent in the past as far as saving. We had quite a bit of reserves set aside because we knew that we would face a downturn at some point in time. We had no idea that this would be the cause of that downturn, of course, but we you know, saved, and we have good, you know, we have reserves in place. The departments have you know, engaged for the last couple of years in 2.5% cuts to their budget as a result of exercises that we put them through, because we did feel that a downturn was imminent at some point in time here. We have a hiring freeze that I put in place probably 3 weeks ago now, in order for departments to start building up their reserves. And, you know, we are waiting to see what the state budget looks like. We know it's not going to be good. How bad it's going to be remains to be seen. We'll know more in July. But we've engaged in a rollover budget right now. We feel that we'll certainly have enough with Department of Reserves and in general fund reserves to get through this year. We'll know more about the state budget by July. We'll look for revisions in September. And we'll have a broader picture then of really what will be at stake here in the future, and to any future maneuvering that we'll have to do to make sure that we have a balanced budget, while also making sure that we provide the essential services that people will need. And in one way, it's a double-edged sword for us, because in a downturn we have less money, but there's more need, especially for the safety net services. You know, that's the dichotomy that we always have to work through, that you know, we make that commitment to people, and when unemployment rates skyrocket, more services are needed at the county level, at the local level. You know, the best case scenario, if we can get through this, and some of this will depend on when a vaccine is developed, when treatment is developed, when the society's safer to reopen, and how we bounce back when we do reopen. All those things remain to be seen, and the long-term impacts to the federal and state budget remain to be seen, which will certainly, absolutely certainly impact us. And then, you know, we started with a health deficit. We expect that deficit to grow, because the clinics are not operating, and the revenue generating services are not there like they typically are during this crisis. Operations that typically would take place have been deferred, and that has also decreased revenues to our institutions. So all these things need to be taken into consideration, and only time will tell where we're at. So sorry about the long-winded answer, but I wanted to give you the full picture of what we're looking at here.
Those are all of the questions.
Okay, thank you all for being here. We certainly appreciate it, and we'll see you back Wednesday. Stay healthy, stay safe.